Epilepsy is a chronic brain seizure disorder. They'll have sudden episodes of intense electrical activity of the brain, and that causes the seizure activity. Um, and it is an involuntary muscle contraction um, episode or convulsion that usually comes with a disturbance in consciousness and sensory. They are not aware of anything. Um, the seizures are classified as partial or generalized. Patients can have what's called petit mal seizures or little seizures, or they can have grand mal or large seizures. Um, it depends on the degree in which their signs and symptoms present, um, their level of consciousness, and so forth. In what's called the tonic phase, the body stiffens. They can bite their tongue. They'll have contraction of the respiratory muscles, and then they even turn a little blue. Um, so, in generalized seizures, it's uh, electrical abnormality within the brain and have the clonic tonic attack. Uh, in the clonic tonic, they may have a loud cry followed by falling to the ground and loss of consciousness. In static epilepticus, uh, in one seizure comes after another. Uh, and in these cases, they're not recovering between seizures. And this is considered one of the more concerning things when they see seizure disorders in patients. In idiopathic seizures, um, they don't know the cause. They just know that they have the outward appearance of seizures, but they aren't necessarily finding an abnormal electrical cause to the brain. In symptomatic, they're going to see um, abnormality in the brain through the EEG, uh, looking at what triggers the seizures. And anticonvulsant medications are one of the choice treatments of epilepsy. And keeping them in control with medication involves being periodically evaluated and retested to make sure that they are staying in control with the medication. Parkinson's disease is a progressive neurological disorder, um, and they will show signs that is called pill rolling or tremor of the thumb and the finger that looks like they're using their fingers to move something, but there's nothing there. Muscle rigidity. They move slowly. Um, they have a shuffling gait. The body posture is kind of bowed forward. Um, and their knees are a little bit. They have a tendency to fall mainly because they don't have the ability to catch themselves. Um, it's called a deficiency of dopamine in the body. Um, we see that more often as they get older. As people get older, we see them at a higher rate, but not necessarily are they always at an older age. So the primary thing you see is the trembling hands, arms, jaw, face, legs. A lot of times they'll camouflage it a little bit in the arm by putting their hand in their pocket or something that stabilizes their hand. But if they're just holding it freely without any kind of a brace or support of anything, then their hand would be very trembling. Um, Stiffness, rigidity in the limbs and trunk, and then degeneration of the nerves in the motor system of the brain stem. To a certain extent, they're not knowing about, but this is, of course, one of the things that's not reversible. A newer treatment for this is called deep brain stimulation that's been proved more recently from the Food and Drug Administration. But the diagnosis of Parkinson's is uh, the characteristic history and the neurological changes, the physical changes you see in that patient. Um, each patient may present a little differently, so you treat them based upon that individual patient. It cannot be cured. Um, Managing it to support them, help to control the symptoms, and help them be as functional as possible. Physical therapy may be beneficial as well. Huntington chorea is a hereditary degenerative disease of the cerebral cortex and the basal ganglia. Um, it is a progressive atrophy of the brain is included. Um, Family history may also be something that is noted with this. Uh, it starts slowly, loss of musculoskeletal control. Um, Arms and the face are the first areas that are typically involved. Um, they kind of fidget or they kind of tongue smack as part of the symptoms. So it's pretty mild or simple. Um, they have a disruption in personality and personality changes. It is an autosomal dominant trait that's inherited. It can be inherited by either sex. So this is something we know that is a genetic factor. Treatment is support them, treat them symptomatically. There's really no cure for it. Medications are Haldol and Proloxin to help them with the movement and reduce the irritation or agitation. Um, Again, no cure. Trophic laterosclerosis, also referred to as Lou Gehrig disease quite often, um, or ALS. It is a progressive destructive motor neuron disease uh, with the muscles basically atrophying or um, just simply going away over time. Um, they typically start out being weak in muscle involuntary muscle contractions. Um, uh, they see it in the forearms, the hands as well. They have difficulty in speech and chewing and swallowing, breathing. They eventually end up on a ventilator. Um, Etiology is unknown. It's thought that it might be an autosomal inherited trait, though, so possibly genetic. Treatment's going to include several different measures and several different subspecialties of care that they would need and therapy. Um, Medication to reduce the fatigue and the spasticity of the muscles, sleep difficulties, and the saliva. It is a slowly progressive disease, um, and typically there's no prevention, just more supportive care than anything else. Restless leg syndrome is kind of what it sounds like. It's neurological. It's basically an intense urge to move the legs. Um, it may also include the arms and the face, but more typically the legs. Walking or moving helps to relieve it. So typically patients will come in because of um, the impulse movement that they have constantly, or sometimes it's family members who encourage them to be seen. So it's like they have, you know, like they have itching or burning, or they're jittery, or something's crawling, or multiple types of symptoms are described here. Uh, they can't sit still for a long period of time, so it interferes with their normal activities. Um, don't know the cause. They may show to be low of iron, but that alone is probably not going to be the cause. Um, so identifying the underlying cause and treating it, if one can be found, is one of the treatment sources. Transient global amnesia. In this, the learning process is blocked. Basically, they have don't have memory of anything really. So they're not going to be aware of where they are, why the whys of anything. Um, prognosis is this is good. They typically don't recur with it. Usually, they'll have difficulty with normal tasks and with um, the neurological signs all being normal. Um, and typically, it's a transient thing that will come on and then go away. So support them during an episode, because again, typically it doesn't recur. Peripheral neuropathy or neuritis is degeneration of the peripheral nerves. Um, they lose sensation in their hands and feet, um, and it can be from a number of reasons: toxicity, infectious diseases, mumps, pneumonia, diphtheria, inflammatory disorders, diabetes, rheumatoid arthritis, gout. A number of illnesses can cause this. Um, they'll look at the medical history and look at what they're finding clinically to determine a diagnosis. Um, so they'll present with clumsiness or loss of sensation in the hands and feet, um, and then become to inability to use them, wasting away of the muscles. Their deep tendon reflexes are going to be pretty much decreased or gone. They'll have tenderness in the muscles, um, and again, several things that can cause it.